The recent approval of aducanumab from Biogen is going to have significant impact on the Alzheimer's market moving forward. First of all, there's been a lot of mixed perception within the scientific community whether amyloid is in fact the driver of the pathology that leads to Alzheimer's itself. Previously, there's not been robust data supporting that actually decreasing the amyloid levels will end up having a cognitive benefit, which is the hallmark symptom of Alzheimer's. All previous antibodies to date that have targeted amyloid, albeit in different ways, have failed. So you may start to see a revival of previously failed molecules from companies such as Lilly, Roche Genentech, who does have several right now in development, as well as Pfizer and J&J. They may go to the FDA to say that we think there may be a path forward given this recent approval, and they may, as a result, try to bring those back. The revival may only last, though, depending if the amyloid hypothesis does end up playing out. And in the real world, you do see that by decreasing amyloid itself, you are in fact improving the cognitive benefits with patients. If not, you will start to see some other approaches, such as tau, or potentially think of more metabolic, what Novo is doing with their perspective that Alzheimer's is type 3 diabetes. This is potentially a net positive because you will see more investment into the space itself. You will see companies that have perhaps moved away or companies trying to think about entering the space itself. We have seen recently that Acumen has mentioned that they're going to do a $100 million IPO to develop a drug within Alzheimer's. Alzion has said publicly that they're going to do a roadshow to raise funding as well. So certainly a net positive in terms of increasing funding for the Alzheimer's treatments, which is certainly quite needed at this point. The concern is that you have to be careful as an investor or as a company. Certainly there's a lot of enthusiasm about the approval, but unfortunately there has been historically a litany of failures and need to be careful about really having a true scientific driven approach to develop new treatments moving forward. The other thing that may be interesting here is very akin to what we're seeing in oncology with immunotherapy. The checkpoint inhibitors like pembrolizumab and nivolumab have become backbone therapies across a variety of tumors. It's been really nice to see how there's been precision medicine approaches, whether it's looking at particular biomarkers or combination approaches, whether it's combined with other IO agents, chemotherapy, or other targeted treatments. It's really revolutionized cancer, and you're seeing response rates and survival rates far superior to what's perhaps been done historically. We may start to see this in Alzheimer's as well, where aducanumab becomes a backbone therapy and is combined with other therapies, such as previously approved therapies or novel therapies, whether they be tau or 5-HT6 approaches. So certainly excited to see potentially precision medicine approaches in Alzheimer's moving forward.